When police finally apprehended 26-year-old Luigi Mangione at a McDonald's in Alatoona, Pennsylvania this week and charged him with the murder of UnitedHealth CEO Brian Thompson, the public fascination with this story only increased. Because just as a big part of this conversation, either the total indifference to the fact that a man was murdered, or in some cases outright glee and celebration of the man alleged to have committed it, like this scene from a Boston concert this weekend where a DJ put Mangione's face on the screen to the sound of huge cheers. It's important to put this all in perspective here.
Welcome back to Drop the Mask. This is episode 32. I'm back solo today after taking a little break from politics with my guy, Mark Poles. That was a bit of a departure, but it was interesting, I think. If you haven't heard it yet, go check it out. Let me know your thoughts. Because as much as I am into the political, economic stuff, even I need a break from it sometimes. So if you want to see more stuff like that, some supernatural, theology talk, let me know. But today, we're back to it. It's been over a week now since this happened, and I think everybody knows about it at this point, but I do want to talk about the UnitedHealth CEO that was killed, shot in the back by this young guy, Luigi Mangione. Allegedly, I should say. He hasn't actually been convicted yet. And we still don't know all the details. A lot of people are pointing at the security camera images of the shooter and saying, it doesn't quite match this guy's face, but I don't know. It doesn't really matter for this episode because I'm not going to recap what happened. That's not what I do here. I'm not a reporter. But just in case you're living under a rock and haven't heard about it, the basics are that the CEO of UnitedHealth, Brian Thompson, was killed by someone in a hoodie on the streets of Manhattan who went a few days on the lam, but then was caught while eating at McDonald's in Pennsylvania. And just a side note, I also saw, and I don't know how true this is, but it's kind of sad and funny, the McDonald's employee that recognized him and called it in didn't get the $50,000 reward because he supposedly called 911 instead of the tip line. I mean, how pissed would you be? If you're working at Mickey D's, that's some life-changing money right there. Also, how did he recognize the guy? The security photos were not good, and he had most of his face covered. Part of me thinks that Luigi planned to get caught, and maybe he told the employee to call it in, because apparently, when he was caught, he was carrying a manifesto. And this part is relevant because the motive, or at least what everyone is assuming is the motive right now, is what's important. Someone did publish what is, allegedly, his manifesto. Again, I can't confirm 100% that this is real. There were a lot of fakes out there, but this seems to be the most legit. Other news sites have reported that it was posted there even when they wouldn't publish it themselves. So this was put out on Substack by a guy named Ken Klippenstein, if you want to go see it for yourself. It's interesting, the news outlets have it, but are refusing to publish. Usually they'll make sure that the ones that align with their agenda do get out, and the topic of American healthcare is definitely on their list. Socializing healthcare is a popular topic for the primarily left mainstream outlets. But if I had to guess why they're not putting it out, it's that the big media companies are in on the same game as big medical companies, and they really don't want people thinking too much about it. The corporate news is funded by pharma ads, somewhere between $15 to $20 billion big pharma spends on ads, from what I can find, and it's all connected. So I guess they don't want to create copycats that start coming after new CEOs or big pharma people, or they could be trying to show some integrity by not giving this guy more fame, if we want to be generous. But that cat's kind of already out of the bag. They already plastered his name and face everywhere. So, yeah, I don't think that's it. But back to what Luigi wrote. I'll just read the most important part of it here. I did cut out a few lines that weren't relevant, but it's short, and this is most of it. And it was handwritten. A few words were apparently too hard to make out, so it'll say indecipherable at that point. But anyway, he says, to the feds, I'll keep this short because I do respect what you do for our country. To save you a lengthy investigation, I state plainly that I wasn't working with anyone. I do apologize for any strife or traumas, but it had to be done. Frankly, these parasites simply had it coming. A reminder, the US has the #1 most expensive healthcare system in the world, yet we rank roughly number 42 in life expectancy. United is the indecipherable, largest company in the US by market cap, behind only Apple, Google, and Walmart. It has grown and grown, but has our life expectancy? No. The reality is these indecipherable have simply gotten too powerful, and they continue to abuse our country for immense profit because the American public has allowed them to get away with it. Obviously, the problem is more complex, but I do not have space, and frankly, I do not pretend to be the most qualified person to lay out the full argument. But many have illuminated the corruption and greed, e.g., Rosenthal, Moore, decades ago, and the problems simply remain. It is not an issue of awareness at this point, but clearly power games at play. Evidently, I am the first to face it with such brutal honesty. So what do we think about this? Well, if you're habitually online like me, you've seen all kinds of people that are glad about it. There's a very pervasive attitude in a large portion of America that all corporations run on greed and are ruining the country. Then you have right-wingers rushing to defend the corporations, clutching their pearls over what they see as an innocent victim being murdered out in the open on the streets of Manhattan. And they're both a little bit wrong. I clipped some of this editorial news report on it from MSNBC, and as you saw in the opening clip, there are many people out there just outright celebrating this guy's death. And I'm not celebrating it, but I do have to admit, it's really not bothering me either. Because I don't know who this CEO is as a person. He's the head of a health insurance company, which are pretty universally awful in the United States, so it's very possible he's a bad guy. He maybe has even made decisions personally that would merit this action. And I'm not advocating for anyone to go around shooting people who you think are greedy. That's not going to fix anything, and it probably will make things worse. But the reaction and the conversation about the US healthcare system are what I want to address in this episode, because the real problems with it aren't just because it's a for-profit industry, and I think a lot of people believe that. I have a few more clips from that segment that I want to share because it's a good jumping off point for some of these topics. So let's get started.
The legitimate rage that people are sharing about the health insurance industry should not come as a surprise. The cold and inhumane reactions to the death of the CEO is a reflection of the cold and inhumane economic system that this CEO represents. An individual taking matters into his own hands is also a reflection of the helplessness that people feel to enact any meaningful change.
Yes, I certainly understand the helpless feelings. Public sentiment, as you can see with the reaction to this incident and in all kinds of polls, shows a significant portion of Americans do favor programs designed to get healthcare coverage for all. But not much gets done about it. The Affordable Care Act, which passed in 2010, was the last big piece of legislation to try to move in that direction, and we'll get into that in more detail, but it hasn't produced the kind of effects that I'm sure its advocates would have liked. This guy calls it a cold and inhumane system, and he's not wrong. There are so many layers between you paying for insurance and you actually getting care that the humanity is just stripped right out of it. Insurers work on actuarial tables that treat people as statistics, not individuals. That's the business, though. It's also the regulations and the legal red tape that make it super hard to navigate or change. And almost everyone will take this as a sign that we need government to do more. But I say that's exactly the opposite of what will start to fix the problems. Here's that guy again, Amon, I don't know how to pronounce his name, from MSNBC.
We just had a multi-billion-dollar presidential campaign where neither candidate addressed that we have a sick healthcare system where profits increase as more coverage gets denied. Donald Trump spent years trying to get rid of the Affordable Care Act, and now that he's in office, or soon to be, is surrounded by billionaires and multimillionaires who may finally achieve the Republican goal of privatizing Medicare. And on the Democratic side, Kamala Harris spent her campaign running away from her past support for a Medicare for all system, the type of system that would take profit out of the equation and center it around patient care.
So it's true that Kamala dropped her support for single payer in this year's presidential election cycle. She really dropped any policy whatsoever and just kept repeating, "I'm not Donald Trump." Trump, I don't think personally ever addressed it, but he has got Robert Kennedy on his team now as head of the DHHS, who has been very vocal about the problems with health, and especially around big pharma. That's not insurance exactly, but it's all connected, which we'll see. There are a lot of problems with what we have now, but the corporate greed boogeyman that people like to point at is not exactly it. It's only a small part of it. And what I really want people to know is that we don't have a free market system. We have government controls at every level. I'll explain. Let's start with healthcare as a whole. I did talk about this to some extent in episode 23, where I broke down some arguments that people like Bernie Sanders make in favor of socialized healthcare, also known as government healthcare. I don't know which one should have a worse connotation in your mind, but whichever that is, use that one, because it's the same thing. Socializing an industry means to monopolize it into the hands of government. And every single time that happens, they make it worse. Government simps will tell you over and over that we have such a terrible healthcare in America, while other countries just have great free healthcare for everyone. They don't look at it as a monopoly, though, because the government is democratic and the people are in control, right? But if you've been listening to this show at all, you know that's a load of crap. For all the criticisms of corporations, they're greedy, they create monopolies, they don't care about people, they're just in it for profits. This is all true of governments, and to a much larger degree. I've probably said it 100 times, but to break it down to the most simple concept, government is the biggest corporation with the added power to legally steal from you. That removes all incentive to be good, up to the point where you're just so obviously evil that the people revolt and do something drastic. But if history is any indicator, we know that people can tolerate a whole lot of tyranny before they will do anything about it. Anyway, Luigi complains that the US has the number one most expensive healthcare in the world, and the outcomes are not necessarily better. In fact, he cites the decline in the last few years of the average life expectancy, which has not happened in other countries. He's correct about that. UnitedHealth, the company whose CEO just got capped, saw revenues rise from $110 billion in 2013 to $371 billion in 2023, going from the 51st to the 4th spot on the Fortune 500 list. Have we got 3.5 times healthier? Of course not. The US spends over twice as much as the next highest country per capita on so-called healthcare. But it's not just the fault of a big corporate CEO trying to squeeze profits. Because while we don't have a totally government-run system, the industry is one of, if not the most, regulated by government that we have. And I'm not just talking about regulations that are meant to protect consumers. Regulations in terms of price controls, what gets on the market, things hospitals and doctors must do that are completely wasteful, and the hoops insurance companies have to jump through to comply and be able to legally operate. That's already a huge barrier between you and a doctor. Health insurance is a disaster because of the conspiracy between the health insurance industry, Big Pharma, and the government. And I would say universities and the media are also complicit in keeping people ignorant of the facts. Luigi was an Ivy League college kid. No doubt that indoctrination played a role in getting him to pull off something so radical. Universities are totally captured by socialists, and it makes perfect sense why, but that will have to be a topic for another day. They are perfectly happy to brainwash young adults to believe that capitalism is a plague on the world, that if we just gave government control over everything, we would all be equal and things would be fair. Because of their massive federal funding, the universities are happy to run this propaganda. The idea, though, that a government-run system will center the industry around patient care is nonsense, of course. Because for one thing, we don't live in a capitalist system. It's more of a bastardized hybrid of cronyism with socialist programs mixed in. Any resemblance to a private market is just for show. I've made the case before that this is essentially the definition of fascism, which, by the way, everyone worried about Trump bringing in fascism to the United States, you don't have to. It's been here for at least 100 years. Also, when you look at nations that have tried to move toward an entirely socialist economy, it leads to the deaths of millions of people every single time. Let's go back a bit and discuss how the healthcare system is anything but a private capitalist institution. The government has been co-opting control of healthcare for a long time. Let's start with this. Everyone knows doctors have to go through several years of schooling to be licensed to practice medicine. But even that process has been compromised thanks to the American Medical Association, or the AMA. An AMA might sound innocent, but what they are is a lobbying organization, a group of doctors and other medical professionals that gets government to make rules in the medical field. They get laws passed that, on the surface, might claim to raise standards and provide the best care, but in reality, it's locking people out of the market. In the very early 1900s, on the recommendation of the AMA, the government instituted regulations that forced medical schools that were not associated with the AMA to close. I don't think there was anything wrong with these schools. They just didn't want to fall in line with AMA standards and be controlled by them. In 1904, when those regulations went into effect, there were 160 medical doctorate granting institutions with more than 28,000 students. By 1920, after this report that was released, there were only 85, and they only had 13,000 students. By 1935, there were only 66 medical schools operating in the US. And you might think that it's a good thing that doctors have standards, so they don't accidentally or on purpose start killing or injuring people. Of course, we don't want that. But not only did this kill the supply of doctors, it put a huge damper on innovation. The only way now for a medical school to exist is to follow the standards set by the AMA. Not a government organization, a private entity who has successfully captured the industry and used government to keep people out. That is, of course, not to say that no innovation was now possible. We've had some advances in medical technology and science, of course, but every time something like this happens, you're severely limiting the innovation that would occur in a free market. So this reduction in licensed doctors obviously benefited the doctors who had graduated from the approved programs because it limits the number of doctors available. You don't have to be an economic genius to understand that if supply goes down and demand stays the same, prices will go up. During the 19th century, American medicine was neither economically supported nor regulated by the government. Few state licensing laws existed, and when they did exist, they were weakly enforced. There were numerous medical schools, all varying in the type and quality of the education they provided. Medical schools were not usually part of universities either, so that's another piece of the capture. Fast forward a bit to around World War II, where government again steps up the pressure against the market. There were wage controls put in by the 1942 Stabilization Act that employers could get around by offering benefits like medical coverage. Then, the IRS ruled the next year that yes, employer contributions to health insurance would not be taxed. These tax incentives encouraged employers to offer medical insurance to their employees. The industry must have loved this. Now, we pay them pre-tax, which means they can rake in even more money. But this really laid the foundation for insurance to be tied to your job, which I say is a huge mistake. Well, perhaps it wasn't a mistake at all, but a very poor policy for regular people. This ties people to their jobs, and everyone has to work, right? But it makes it so much harder for people to change jobs, which having flexibility in your job is not only good for you personally, it's good economically. If you're more satisfied in another job, you'll be very likely to be more productive, or your talents can be better used in another position. Again, this is good for you, and it helps to satisfy consumer demand more efficiently. Being stuck in a job because of insurance, and my God, look at how much COBRA payments are if you're without a job for a bit. It's not only bad for you, but it exacerbates the problem of healthcare costs. It allows doctors to charge higher prices since the insurance policies will cover all or most of the cost, and now you're mandated to pay for it. You don't have the option to shop around for different providers. You're stuck with the one your employer chooses. And I've been in the corporate world for a decade. I've never seen plans get better. As the costs grow, the company gets bigger and has more people to pay for, the benefits shrink. Deductibles go up. And there's really nothing you can do about it because it's paid for before you ever see the money. That also means American salaries are that much less because it's an expectation, even a requirement now for employers to pay for this. there has been a slow trickle of increasing socialization of medicine. And in the 60s, it took another leap with Medicare and Medicaid. Before these programs, despite the government interventions into licensing and tax incentives, the medical field was still a pretty low expenditure for Americans. Costs were still fairly low and stable, and most people didn't have insurance because they didn't need it. They could easily just pay for a doctor visit out of pocket. In 1965, the Medicare and Medicaid Act, or the Social Security Amendments Act, was signed into law by President Lyndon B. Johnson. The propaganda supporting it says that this was aimed to combat rising healthcare costs for the elderly. It's still celebrated as a huge victory for giving people access to care. And while it may have got more old people into a doctor's office, what it did was absolutely explode the costs of healthcare for everyone. In 1965, before this went into effect, healthcare was at 2% of federal spending. And as of 2019, it's 33%. You could say that part of this was due to innovations. More treatments and tests had been invented, meaning there's more for patients to spend on. And we can't ignore the effects of changing diets in the United States. The demand for medical care must have been creeping up due to increases in processed food becoming more commonplace. By the 60s, I'd guess that the country was starting to see those effects. In fact, President Johnson died at the age of 64 after having 3 major heart attacks. Eisenhower had one in 1955. But before that, heart attacks were really uncommon. And that event, a president having a heart attack, was shocking to the nation. So yeah, that lines up with my theory pretty well. That history is all spelled out in the book Fiat Food by Matthew Leshak, who I had on the show back in episode 14. But the biggest reason for this price explosion is the economic one. The government was already keeping the supply of medical services artificially low, which raised prices. Medicare and Medicaid did nothing to address those shortages, but it did throw a shit ton of tax dollars into the healthcare furnace, significantly increasing demand. So now we have a major artificial decrease in supply and a huge artificial increase in demand. Combine those things, and the result was an easily predictable rocket to the moon for the costs of anything to do with a doctor or medicine. And it wasn't just a one-time thing. Medicare and Medicaid have seen several expansions over the years, and there are always efforts to move to a single-payer system like they have in Europe. Finally, the next big step was taken in 2010 with the so-called Affordable Care Act, also known as Obamacare. This came about in 2010, allegedly with the aim to increase health insurance coverage, improve quality, and reduce costs. Here's how they meant to accomplish that. 1. Mandatory insurance coverage. This is known as the individual mandate, and it meant that pretty much every American had to buy health insurance or pay a penalty at tax time. And there were people who needed insurance that couldn't afford it. Fine. But there were also a lot of people that had already made the personal calculation that buying insurance was not worth it for them. Now they had to do it anyway. You think insurance companies might have had a hand in this? Of course they did. This is huge for them. Just like with vaccines. Make it so people are required to take your product and you're guaranteed profits forever. And it's almost impossible to compete if you're trying to break into the industry because everyone already has to pay for the mandatory one. So there's little or no incentive to ever improve the product or reduce prices. 2. They reformed the insurance markets. This meant protections for pre-existing conditions, allowing young adults to stay on parents' insurance until age 26, as well as removing lifetime or annual coverage limits. No limits means only the big companies can stay in business, but even then, they had loopholes to get out of paying for things. Family coverage up to 26 can be helpful for the few kids that do need it, but college-age kids hardly need any medical stuff. Yes, there are exceptions, but mostly it's emergencies from doing stupid things, getting in a car accident, or getting alcohol poisoning from binge drinking in school. You don't want to saddle kids with massive medical debt while they're just figuring out life, sure. But making companies cover pre-existing conditions defeats the purpose of insurance. It completely erases the line between insurance and care, which we'll come back to. But the point is, All that care shouldn't have been so expensive in the first place. 3. They expanded Medicaid by offering additional federal funding for states to put more low-income adults on government plans. I believe that a majority of people wouldn't mind helping out their community, paying a little bit extra to cover an emergency situation. And I'm not against a plan that's voluntary that does do something like this. But here, you're taking money that we already don't have because we're trillions in debt and just increasing everyone's costs substantially. 4. They created the health insurance marketplaces. They worked with health insurers to build exchanges where people could purchase insurance with subsidies available for those with lower incomes. Again, insurance companies loved this, at least the ones that were allowed to be part of the exchanges. Government subsidies equals guaranteed income, and only a select few insurers were able to be part of it. And relevant to this murder is UnitedHealth Group. Again, this is one of those companies, and since the ACA, it's seen profits rise somewhere in the neighborhood of 400%. And then there's the employer mandate. What had become customary was now codified into law. Employers with 50 or more full-time employees now must provide their health insurance for them or pay penalties. There are a few problems with this, and one is that they defined full-time as anyone working 30 or more hours a week. I was in college when this passed, and I was working a technically part-time job, but I was able to get enough hours to cover my expenses. After this, instead of providing me health insurance, my employer decided I could no longer work more than 29 hours. That's what happened with a lot of people. Instead of getting coverage, now you're making less money and you have to figure something else out, which often meant working a second job or trying to balance two schedules when you were doing okay with just one. And you could imagine also, if you're in a growing business that was right around 50 employees, maybe a few over 50, you've got a serious choice to make. Do you let people go? Do you take that hit? And if it's not financially viable, you might have to start firing people. Is that enough? I mean, man, I knew it was bad before I started digging into it for this episode, but when you start to break out the secondary and tertiary effects, it's really bad. And what it has done is make everything much more expensive for everyone. The CEO is making millions precisely because the government gets involved. And you could point to a slight increase in the number of people covered by insurance after the ACA. But this is the cost, a giant wealth transfer from the poor and middle class to the CEOs. And that MSNBC report actually covered some good stats with what's going on with healthcare now. That will back me up.
UnitedHealthcare is the country's largest health insurer with 50 million customers, and multiple reports suggest they also lead the industry in denying claims, with a rate at nearly double the industry average. ProPublica has a powerful new piece out about how UnitedHealthcare is strategically limiting access to critical treatment for kids with autism. UnitedHealth initially declined to respond to ProPublica for this story, then said they couldn't respond because they are in mourning and didn't have time to deal with a non-urgent matter. And it's not just United. There are new reports about how health insurers gave $120 billion to shareholders while denying your claim. Or how since the Affordable Care Act's passage, the top 5 health insurers' annual profits have jumped 230%.
So even on this left-wing news channel, they'll admit that since Obamacare, these companies' profits have skyrocketed. I still doubt they make the connection that it was the direct cause, not just an accident or a little flaw in the plan, but we're still talking about insurance. And one important point I want to make to take it up to a higher level is that insurance is not healthcare. Insurance has a place in society. For emergency situations where an extreme intervention is required, insurance can be very helpful. It's mitigating some risk on your part because even though those emergency situations are rare, it could be devastating to be stuck with a huge bill if it does. So, insurers do a lot of calculation to figure out what they need to charge in order to stay in business. It's very hard to calculate at the individual level when one person will be in need of that. But an entire population, it's easier to calculate what percent of people will need certain categories of care. So with insurance, you're trading that risk to the company for a fee so they can pay people to make those calculations and, yes, also take home some profit. But with this business model, on average, you're going to lose because it doesn't matter if it's private or government controlled. In order for them to stay in business, they have to take in more than they pay out. That means, again, on average, that everyone comes out behind. It's adding a middleman. So companies make this calculation, and, for emergencies, you could be glad you bought it. But as I think I've beaten into you by now, when government messes with those calculations, by interfering in the market, they create a disaster. In the system we have now, there are a handful of companies that have been favored by government, and they have excluded others to the point that they can pretty much do whatever they want. They've made the system so complicated that it's a huge burden just to use it, for patients and for doctors. That's part of the reason why you can go get a much better price for services when you don't have insurance. So insurance itself is not entirely a scam, but what we have now is. And the way people talk about the issue today suggests that they equate insurance with healthcare, and that's far from the case. We talked about the explosion in costs and spending on care, but do we have better outcomes? Nope. Despite a massive $4 trillion that we spend annually in the US, chronic diseases like cancer, diabetes, arthritis, heart disease, Alzheimer's, autism, obesity, multiple sclerosis, lupus, asthma, and migraines have all significantly increased since the 1970s. Insurance companies don't profit from curing disease. They profit from expensive treatments. And most of the time, doctors are pushing pharmaceuticals, which occasionally can be helpful and necessary, but very often they are meant to treat a symptom, regardless of what new symptoms might arise. We could go on for some time about the FDA and how they've colluded with drug companies to gouge the crap out of people. But it's at the point where basically the drug companies are the FDA. And there's no way for competitors to break into the market because of all the fees and regulations they put in place to get a drug legally into a store. So insurance is not healthcare. Insurance is a fraudulent, money-grabbing scheme that is one piece of the oligarchy of the medical industry that is meant to keep us sick, just healthy enough to keep generating income for them, but too sick to really do anything about it. I don't know how much of that is malicious, purposeful harm to people, or how much was just a happy accident. People think that if you have insurance, or especially if you live in a country with single payer, your healthcare is free. And of course that's false. Nothing in life is free. It's just an attempt to put your expenses onto someone else. Frédéric Bastiat has a great passage in his essay called Government and explains the tendency of people to think that collectivizing your problems is a good solution. Bastiat says, "It is the original inclination which exists in all men to divide the lot of life into two parts, throwing the trouble up upon others and keeping the satisfaction for themselves. It remains to be shown under what new form this sad tendency is manifesting itself. The oppressor no longer acts directly and with his own powers upon his victim. No, our conscience has become too sensitive for that. The tyrant and his victim are still present, but there is an intermediate person between them, which is the government, that is, the law itself. What can be better calculated to silence our scruples and, which is perhaps better appreciated, to overcome all resistance? We all, therefore, put in our claim, under some pretext or other, and apply to government. We say to it, I am dissatisfied at the proportion between my labor and my enjoyments. I should like, for the sake of restoring the desired equilibrium, to take a part of the possessions of others. But this would be dangerous. Could you not facilitate the thing for me? Could you not find me a good place, or check the industry of my competitors, or perhaps lend me gratuitously some capital which you may take from its possessor? Could you not bring up my children at the public expense, or grant me some prizes, or secure me a competence when I have attained my 50th year? By this mean I shall gain my end with an easy conscience, for the law will have acted for me, and I shall have all the advantages of plunder without its risk or its disgrace." That's really what it comes down to. You get all the advantages of stealing with none of the risk. Stealing from people normally would be dangerous, but we've come to expect it when it comes to the state. The whole idea of government is that we can magically get things at the expense of everyone else, but we're all paying for it. And we're adding mountains of regulation that makes it infinitely more expensive and makes it almost guaranteed that those companies will stay on top. Because our tax money subsidizes it, most of us can't take our business elsewhere. A lot of people think we should move to a single health payer system, like Canada or the UK. They like to think it's free healthcare because they don't stick the bill directly in your hands. But when you get the free plan, it sucks. By many metrics, it's worse than in the US, but they love it because it's, quote, free. Right now, you hear people like Bernie Sanders and left-wingers complaining about how bad our system is. But I expect that if it were to happen here, that once government completely captured the industry, the propaganda would flip to, oh, this is so great, even when you have all of the same problems with some new ones. But it's easier when no one gets a bill directly. And that's the problem with it all in the end. When you don't see the bill, you don't care. But you really should care when you start to see 50, 60% of your income going out the window in taxes. Politicians want it because it gives them more control over your life. That is what draws them to the job, whether they consciously know it or not. And there's one more problem that I haven't really hit yet. It's that we think we have so many answers to medical problems already. And yes, there are some, like surgical interventions, are absolutely critical. There are certain things like insulin shots that people can't live without. There have been all kinds of advancements in medical technology, for sure. But for the most part, I'm convinced that medicine itself is a scam. Pharmaceutical medicine is largely not only ineffective, it's often very harmful. Everything from the way that drugs are approved to how they're patented and sold is really horrifying when you get into it. If you think the FDA is protecting us from harmful drugs, you should think again. Studies are run by drug manufacturers themselves. The FDA only has to review the evidence that these companies choose to submit to them. They don't have to include the raw data of trials. You might be familiar with some of the data that came out about the COVID-19 shots. They did trials in which the control group had 2 people die from COVID, and the vaccine group had only 1 out of thousands of people. And because of this, they were able to legally make the claim that the vaccine was 100% effective. In any normal industry, you'd get your ass sued for fraud so fast. But vaccine makers are immune from lawsuits because of their government connections. And because of that stat, they were able to sell multi-billion-dollar government contracts and start getting people fired and ruining their lives if they didn't want to take it. You heard the president and everyone on TV claiming that the spread stops with the vaccinated, which was, of course, a lie. The evidence isn't strong that it even did anything. So yeah, pharmaceutical companies can manipulate and selectively publish trial results to favor their products. And by the way, half the FDA's budget comes from companies paying the fee to have their drug evaluated. Medical journals are owned or have serious conflicts of interest in publishing, but they hype up the drugs that they get paid to. These then get written into standards of care, and doctors have to follow them or risk losing their license. All of this to say, yeah, US healthcare sucks. It's about profits over people. It doesn't matter how good a person your doctor is, they are bound by it. Because of the systems in place, they have no choice but to charge higher prices to stay compliant. People can't pay directly for care, so they're stuck going through insurance. And the insurance companies are raking in the dough. So what do we do about it? Eamon asks the same question here.
At the same time, vigilantism and murder won't fix it. As a matter of fact, it may just lead us to more acceptance of the disposability of human life. That's supposed to be what we are all fighting against. So if someone is angry at the legalized corruption of the healthcare industry, where can they channel their anger? Who is fighting on their behalf? What movement can they actually join? If any positive can come from this murder, it is that 1, this horrendous and sick system must be fixed, and 2, we must have legitimate outlets or movements or places to channel our anger at these cruel systems and actually have them respond to us. We must have the ability to do something about it in a legal, nonviolent, and democratic manner. We can be sure that the insurance industry will do everything in its power to fight this.
Well, if you followed me this far, I hope you're starting to have some answers to this. We don't have anywhere to go because these insurance companies have captured the industry. Not because they won the market fairly, but because they were able to regulate others out of it. They own the politicians, at least enough of them to keep their status and keep these regulations in place. I've mentioned the revolving door between the FDA and the pharma companies. They take care of themselves there. Pharma and insurance are two of the top three spenders on lobbying in the US, to the tune of over $500 million in 2023 alone. This funds campaigns and PACs and keeps bad people in office. So looking to the government to fix it is honestly just a fool's errand. They created the problem, and they profit from it very much. So when he asks, what else are we supposed to do? There's not a great answer, not on the government side. Notice he says we need a democratic way to make our voices heard. But the democratic method, also known as voting, hasn't worked. Socializing care would only make it worse still. And most people are just waiting for someone else to fix it. And Luigi took it upon himself to take out who he saw as one of the big perpetrators of this very complex scam of a healthcare system. So I understand feeling helpless and wanting revenge. I understand having contempt for someone who's making millions while the workers barely scrape by. And that's even more understandable in an already contemptible industry like the health insurance one. There are big blind spots on both sides. And as I think I've made very clear by now, I also have major issues with the United States healthcare system. There are certainly elements of greed, but most people on the left don't identify the correct culprits in it. And then people on the right make excuses. And of course, I don't think we should just go around murdering people when we think they're greedy, but I didn't find myself losing much sleep over this. And it's not that there aren't real solutions. I see more and more stories about people bypassing insurance companies. There are doctors that do subscription-based payment models where you're able to get service without insurance. You cut out the middleman. There are places that only accept cash payments. They're very few and far between, but they are there. There are group programs like Crowd Health. I can't vouch for it personally, but I hear good things. It's similar to an insurance model where you're in a pool of people, you pay a monthly fee, and they cover emergency medical bills. But they pay directly, so doctors aren't getting the whole insurance billing runaround. And so you still get out-of-pocket prices compared to the jacked-up prices that insurers charge. The solutions that are starting to push back against this are not government solutions. They're private, free market solutions from people that are sick of this system. But the truth is, even though it's wildly expensive, the US still has the most comprehensive and available healthcare systems in the world. It has a lot of problems, yes, but the problems aren't because the government hasn't taken it over and streamlined it. It's not that they just did the wrong thing. The problems are precisely because of government intervention, and it's been happening for a long time. The only right thing to do is for them to get out of the way. You make your voice heard with your dollar. Don't pay for shit care. Don't pay for scam insurance. In a genuine free market, healthcare would be a matter between the patient and his or her physician. Insurance, if you have it at all, should be reserved for catastrophic illness, not your regular maintenance care. Some smarter people than me have more answers and are building real solutions, so I'll have to get somebody on to talk about it more, but it should be pretty plain to see by now, when you're looking for it, just how bad government gets in the way and makes it worse. So, I hope that covers it. If I missed something or you still have questions, please let me know. I do want to hear from people. Find me on my Locals channel, dropthemaskpod.locals.com, or on X @dropthemaskpod. Thanks everybody for listening, and I'll see you next time.